Hello, my name is Rachel DiMaria, and my speech today is on treating seizures and when to call 911. Today as an audience, we have via FaceTime my brother-in-law Andrew, my sister-in-law Emily. Can you guys say hi?
Hi. Hello.
And my mother-in-law Cindy.
Hi.
And behind the camera is my husband Ted.
Hello.
Have you ever had someone have an epileptic seizure around you? Most epileptic patients have been mistreated, abused, or robbed. This is very common in the epileptic community, yet no one knows about it. There's actually been cases where people have done experiments just to see if it's common. What Would You Do has actually done this and filmed it and put it on YouTube to show just how common it is. And most every time the epileptic patient has been robbed. I have epilepsy. I've had seizures in public, and that's something that's very concerning to me. I don't know if I've been robbed or not. I've had my purse just laying in the middle of the parking lot, so I've actually been mistreated during seizures. I've been left in the middle of a ER waiting room with no one there. Unfortunately, it's been very scary. So the thing that I wanted to do is make sure I educate people on how to treat epilepsy. First, how to provide proper first aid. Everyone has different types of seizures depending on what kind of epilepsy you have. I have grand mal seizures. You can have petit mal seizures. Those are kind of like daydreaming seizures. My particular seizure is when you go and just clunk out and fall on the floor. So with that, you want to basically just make sure there's a clear area on the floor for the person, and then put a pillow behind their back and turn them on the side, and then put a jacket or something underneath their head. That makes sure that they have a clear breathing airway. If they throw up, then they will be able to get that vomit out and not have choked on that vomit. This is actually new. Before, they used to have you laying on the back. When I was doing my first aid last time, they didn't want you putting anything behind them. Hi, Buck. Please do not put a spoon or fingers in a person's mouth. It's high risk for you getting injured and also breaking their teeth. A lot of people think this is something you should do to prevent somebody from choking on their tongue, but that is not possible. Yes, we do bite our tongues, but it's temporary pain. So always clear that safe path for them, because a lot of times we will fall and hit something, or if we're shaking around, we can get severely hurt. So that safe path is important. Hold on 1 second. Okay, in the event that we do have a seizure, it is not an emergency situation. If you feel the need to call 911, wait, because there's a few things that will have to be done. First, start timing the seizure immediately. If it goes to 5 minutes, that's when you would call 911. Or if there's more than one seizure. So normally a lot of people would immediately go to calling 911, but it's not an emergency. The other thing is if the patient stops breathing. So if the person is pregnant or has medical conditions like diabetes or heart disease. Obviously, if you don't know the patient, you're not going to know these things, so you might want to call 911. Also, if it's their first seizure. Sometimes if you don't know the patient, you can just call 911 just to be sure. But if it's a family member and you know, then you can call 911. Or you don't have to call 911. Don't ever perform CPR on an epilepsy patient if they stop breathing. Normally they will start breathing on their own. You will get your tongue bit off immediately. So It's the worst thing to do. So let them breathe on their own. If all these questions have no on them, then you can go ahead and let the patient follow up with their neurologist the next day. So also, don't ever leave a patient alone. It's very scary when we wake up and we are in a state of delirium. So stay with us and make sure that we are good to go until we are in a state that's normal. I've woken up and basically not known my birth date, not knowing what year it is. I thought it was like 1997 or whatever. So it's very scary when we wake up, and it's best that if we know you, stay with us so that we feel comfortable. Having a random doctor around us is probably not the best, even though it is somebody that knows what they're doing. So if you would like to look at the links provided, I can forward them to you, and you can get more information on epilepsy or donate to the Epilepsy Foundation. Thank you for coming and listening to this brief. I hope you have a nice day.